Dr. Ann Doig has spent her entire 30 years in Saskatoon serving the patients of City Centre Family Physicians, the successor of her father's original practice in Hawarden, Saskatchewan. Together with the other physicians in the practice, the Doigs have provided continuous comprehensive care for more than 50 years to people from Saskatoon and many outlying communities, including Hawarden. Anne graduated from the University of Saskatchewan's College of Medicine in 1976. She completed postgraduate training in family medicine in Saskatoon, was certified by the College of Family Physicians of Canada in 1978, and granted a fellowship in 1994. She's been in full-time practice since 1978 and is an active member of the practitioner staff of the Saskatoon Regional Health Region. A clinical associate professor in the Department of Obstetrics and Gynecology at the University of Saskatchewan, Anne has been honoured twice for her commitment to teaching. In 1990, she was named Clinical Teacher of the Year in Family Medicine by the medical house staff at Saskatoon City Hospital. In 1996, she was the Saskatchewan recipient of the Excellence in Teaching Award from the Association of Professors of Obstetrics and Gynecology. So without further ado, Dr. Ann Doig.
I put my glass of water down on the shelf underneath, and I can guarantee you that if I need to grab it, I'll probably drop it all over my feet. So, having put it there, I presume I won't need to grab it. Well, thank you very much indeed for that introduction, Lydia, and I'm very pleased that you truncated it. It's one of the most embarrassing things in the world to listen to people read your bio, and every time I hear them say certified in 1978, I think, yeah, I probably should have been. Well, again, thank you for the opportunity to be back here in balmy Newfoundland. I do say back here because I was here just a couple of months ago. Some of you may have been contacted by the Ipsos Reid people to participate in a focus group, and I was here with Ipsos and with CMA staff to do that focus group, and also I've been here probably 3 or 4 times over the last 10 years to do various things with swimming and also with the alarm program that I teach with the SOGC. So I must say I absolutely love St. John's and I love Newfoundland, and if I ever get the chance to retire from Saskatchewan, you might be on my retirement bucket plan. I'm not quite sure. I was a little worried a month or 2 ago when I heard that Premier Williams said that he didn't want the CMA to have anything to do with him or him to have anything to do with the CMA. So I thought maybe I might get stopped at the airport on the way in, but I guess maybe he had other things on his mind today. So here in Newfoundland and Labrador, all joking aside, you've been faced head-on with many challenges concerning healthcare. The issue of the hormone receptor testing and the subsequent inquiry and report led by Justice Cameron, and then the very public issues that have arisen over your negotiations with the local government. And I was quite disappointed to hear today that those are still ongoing negotiations. I actually spent some time recently with the Canadian delegation that went to the World Health Assembly, and your Minister of Health, Jerome Kennedy, was also part of that delegation. He seemed to be very confident that by the time he arrived back, the entire situation would have been resolved. It would be rather easy under those circumstances to go into a type of siege mentality, but I must commend Dr. Lewis and Mr. Ritter and the entire NLMA organization, and indeed all of you from Newfoundland and Labrador, all of you physicians, for sticking to the high ground and putting your concern for your patients first. My kids used to call that a well, duh comment, but I think it's important for us to recognize your effort, since it is not always easy to take the high ground. I would also like to congratulate the irrepressible Dr. John Haggie for his nomination as CMA President-elect by the NLMA. You heard me hesitate over the adjective irrepressible, and I hesitated to emphasize it because actually we hesitated about putting it in the speech, and one of the people at CMA said to me, "Do you think that's appropriate?" I know there was a very strong field of candidates from here in Newfoundland, and I know that Dr. Haggie will do all of you very proud as CMA President. As physicians, our work delivers the quality of care upon which our patients depend. Our commitment to our patients, yikes, somebody's out to get me. Our commitment to our patients ensures that Canada's healthcare system continues to deliver, even if at glacial speeds. Our role also gives us unique responsibilities. We must be the leaders championing the changes that will push the healthcare system to greater efficiency and higher quality. The physicians of Newfoundland and Labrador have always embraced that role, and you continue to do so. As physicians, we cover an enormous spectrum of human experience in our relationships with patients and their families. We are the front line for a high-quality, patients-first healthcare system. To me, this is where all of our choices begin and end, with the impact on patients and patient care. This may seem like common sense, but common sense is not so common in some of our healthcare debates. Canada's physicians have always spoken up on behalf of their patients in times of need.